Good afternoon, everyone, and welcome to the first EORNA webinar in 2025. This webinar is titled Operating Room Environmental Impact Fact or Fiction. My name is Manuel Valente. I am a representative of the Portuguese Association of Perioperative Nurses at EORNA and a member from the Executive Committee of the European Association. My role here today will be to moderate and facilitate the debate and information sharing process regarding environmental impact in healthcare organizations in general and in the operating room in particular. Not wanting to waste any more time, which is necessary in the research that is always scarce, I would like to introduce you to our two speakers and experts at this event. Firstly, we will have Dr. Carmen Lima, a Portuguese expert, who will give us a talk entitled Hospital Environment Impact, a Wide Vision of the Problem. She holds a degree in environmental engineering with a specialization in environmental management, a postgraduate degree in sustainable construction, and a master's degree in planning and sustainable construction. She is currently pursuing a fellow doctor in environmental engineering at Instituto Superior Técnico in Lisbon, focusing her research on asbestos. She's also enrolled in a postgraduate business management program at IS Business School in Lisbon. With over 20 years of experience in sustainability, environmental certification, waste management, and asbestos risk management, as well as a strong connection to environmental and civic movements, she has become an active voice in promoting these topics. She has participated as an organizer, speaker, and moderator at various national and international conferences, hearings, seminars, and she works as a consultant in the fields of sustainability and environmental, social, and corporate governance. She is the founder and president of SOS Amianto, a Portuguese association for asbestos protection. She also served as executive council member of the Portuguese Confederation of Environmental Defense Associations, as a vice president of the Portuguese Federation of Cycle Touring and Bicycle Users. She is the author of the book, There Is No Planet B, Tips and Tricks for a Sustainable Environment. Carmen also collaborates with the organization of the World Youth Day in Portugal in 2023, working with the Directorate for Dialogue and Proximity to oversee sustainability initiatives. She serves as an advisor to the Economic and Social Council, representing the National Environment Defense Association. She also coordinates the Waste Information Center in Quercus and was the creative leader and coordinator of digital application Waste Ape and Bikeway. She was the media presenter of the segment Querido Ambiente, or Dear Environment in English, co-presenter of the Green Minute in Portuguese television channels programs. Carmen also regularly appears in the media as a commentator specialized in the sustainable asbestos. Second speaker, Dr. Natalia Magasich-Airola, is the Belgian, and her talk will be titled Greening the OR from Theory to Practice. Graduated from the Université Libre de Bruxelles in medicine in 2006 and in anesthesiology in 2012. She's specialized in pediatric anesthesia, and she works in the past at the Queen Fabiola Children's Hospital in Brussels, and today she is an anesthetist in the Clinique Universitaire Saint-Luc, also in Brussels. Her particular interest is in sustainable development in healthcare environment for several years, and she develops green projects in the Clinique Universitaire Saint-Luc at Brussels in the operating rooms for the last 3 years. She created a green team, and the objectives are combating waste, recycling waste, and training and information for operational theater users. Their talks will last 30 minutes, after which the speakers will be available to debate questions and comments from the participants. We hope that this event will promote action for change against the environmental impact of health sector and an objective pursued by EORNA. Questions may be asked during the presentation in English in the questions and answers area. Please do not use the chat for the questions. I thank you for your all present in this webinar, and I invite the first speaker to begin a presentation. Please, Carmen, stage is yours.
Thank you. Good afternoon, everybody. Thank you, Manuel. Thank you, Natalia, for sharing with me this this issue and this discussion. It's for me such an important issue to talk about with you. Regarding what is necessary to do in the medical issue and in the sustainable vision. So it's really an honor to me to be with you and to share with you my knowledge about sustainability, and hope that I could approach to some point of issues that we would like to hear with me today. So I will share with you my presentation. I think you all can see it. Oh, sorry.
Perfect.
Okay. So what you invite me to share with you, it's like a wide vision of the sustainability problem in a hospital, and what impact what all of you and all of us that use this medical service, what we impact in our days. So it's a really a challenge to talk with you about that issue, because it's a issue that we will start to approach today, but you will discussion every day in your hospitals, in your life. So it's really a great challenge, and we have conscience about that we will not solve the problem today. So in hospitals, we have several complicated problems that we have to deal with daily basis in hospitals. One of the great difficulties to solve is the use disposable products. We forbidden some of them, the single-use products, but only 10 kind of single-use products, and most of them we don't use in the medical way. Both of level of healthcare we have in this use, not only in the hospital service, but in cafes or even in doctor office. And then there is also a fact that hospital waste produce which has very strict specifications, that is so that it's not allowed to mix the groups, the medical waste, and that requires a separate forward and sending them to really a specification companies. We have a great impact on hospitals, which is really real. It's really related to the production of waste, but this is not the only problem that we have in hospitals. We have a diversity of kind of materials, and we have different kind of materials, some of them that are hazards and another group that are not dangerous. So it's really a challenge that when we have to look to the waste that we have and to the materials that we use in hospitals, and to think what we will do to separate them and to be able be efficiently to do the destination to that kind of materials. The non-hazardous groups, we have a potential that limits their resolution, which is the fact that some of the large quantity that we use in hospitals are disposal products, and the other ones that are disposal plastic products, that sometimes it's not easy to separate it, to collect them, and to be able to collect them to recycling. And sometimes we don't have only the difficulty, we have the forbidden to collect them and to be able to send them to recycling. And it's not only because the legislation that forbidden us, it's because it's too difficult to implement in the way and that we management the hospitals, and in the way that we are management the waste, and to to involve the medical people, the people that work in hospitals. The waste that we need to look, it's really a challenge, because every day appears in hospitals different materials. Every day we have more and more plastic in that materials, and the legislation in some ways don't be able, that they are not able to walking so fast as that materials are appearing in the hospitals. Another major impact on hospitals are the water consumption, and consequently the production of the liquid effluents that usually have a high level of contamination. And because we use a lot of water in the medical services, the medical hospital, the medical activities, not only for hygiene, sterilization, and for the operation of the equipments, but for all the sanitary facilities. We have the service of the hospitals, and the services of the support areas. And we have a lot of consumption, water consumption in, for example, laundry services, and in the gardens. So if we had all of these activities and all of these uses, in the end, it's a large use of water, some of them with a high level of contamination. And this water could not be able to disposal in a normal way like we do in our houses. The effluents that are produced in hospitals, that because have chemical substances, and that water becomes contaminated, they have to be able to have a treatment before they could be before they could be able to collect in the normal way to collect the water. This water came in contact with chemical substances, and for example, in the sanitary facilities, or in the use of medical treatment. And this water requires a specific treatment, meaning that cannot directly discharge in the municipal sewage system. Instead, it must undergo to a pre-treatment before being released into a sewage network. And this pre-treatment should be carried out in the hospital facilities, not out of the hospital. In other words, we could treat this water and reuse this water in the hospital, in, for example, for gardens, if we be able to think about that. This is really a concern because it's the disposal of this water without a treatment could have a high level of impact, environmental impact, and a high level of impact in a community. And so we have really high responsibility to do a really good treatment of to this water. Another problem that we have to deal every day in hospitals is the high energy that we need for hospital services, not only for lighting, temperature control to ensure that our environment are comfortable for the patients and for the people that work in hospitals, and for all the facilities that the hospital have to offer, including, for example, the medical rooms, the laundry services, the cafeterias, and all of the service that all the hospital have to do and have in the global way to work. The entire hospital infrastructure is heavy and depends on electricity supply, making the energy efficiency a crucial aspect for the hospital management. Since hospitals operate continuous, most of equipment is running 24 hours, 7 days a week, their energy consumption is extremely high. Therefore, implementing efficiently measures an essential issue, and it's not only to need to reduce this energy use, but also to optimize the consumption. Moreover, we have observed that many hospital buildings were not originally designed for medical use. As a result, they often present deficiencies in terms of ventilation, air conditioning, or lighting, ensuring poor lighting for medical activities or maintaining a comfort temperature, or even leads a higher energy consumption to be able to put the building in a good function hospital. It's because this building are not designed for a hospital, so they have to they in most of hospitals they adapt the building. Additionally, some hospital buildings are quite old and outdated in terms of modern requirements for ventilation, energy efficiency, or thermal comfort. Ensuring compliance with their evolving standards often necessitates significant energy consumption. Looking ahead, we face with several changes for the future, and we have to look for them with a very open eyes, because we have targets to require for us to make buildings more resistant to climate change, and we have to lead with the decarbonization goals. So we have to look for these buildings and for the use of energy and for the consumption of energy with a very careful way. It means that reducing energy consumption, especially in fossil fuel sources, and replacing them with clean energy alternatives are the goals that we have to put in our future. There is a crucial need that needs to adapt all these buildings, and particularly the high energy consumption ones, like hospitals, to be more resilient and more energy efficient, while railing on and put them with clean energy sources. Additionally, there is an urgent need to reduce the waste that we are producing in our hospitals, and it requires updating of legislation that are that classifies the waste, the hospital waste, according to the reality from the past. We need to put this legislation more close to our present and the future of the materials that we are using in the hospitals and that we are producing them in waste. In our days, hospitals are using a variety of materials, including different types of plastics, like I said, and in a new innovation materials that most of us don't know what to do with them. And we have a lot of difficulties to identify what is the container that we have to put them. But most of them, we know that perhaps it could be they are not contaminated, and they could be able to take them to recycling. A key aspect that we could use in this collect of waste is that it's not being a contact in most of rooms are not contact with the contaminated environmentals, and they are not they don't have a biological contamination. They don't really have contact with patients. So we have to look for these hospital realities and for these new materials with other eyes, and to look for them and to see what we could do to reduce the waste that are classified as contaminating waste, and that we could pick up and improve them for recycling. This knowledge that we have today could help and determine which waste that is requires to incineration, and which we could process them to the alternative treatment methods. It's also important to recognize that in hospital support areas such as medical rooms, cafeterias, stores, in these spaces, the waste produced, it's not they are not contaminated. They are very close to our household waste. So those types of waste are considered as like equivalent with the municipal solid waste, and should be managed and disposal just like similar waste, municipal solid waste, and just like we do in our homes. On the other hand, the hospitals sometimes of waste have specific areas that need to be management with careful and handling separate from the others. For example, the specific hazard waste. Some groups have specific legislation, and some of them it could not be management by the normal medical and hospital waste enterprise. We have to look for a special destiny for that waste. There are some hazards with contamination, with biological contamination, have a different treatment that are not incineration. So we have to look for the waste. We have to look for the medical waste to achieve the legislation for the present, to achieve the legislation with the new materials, and to see and separate what is really contaminated, what is, for example, needs to be in providing for a treatment needs to providing for incineration, or for example, the radioactive waste needs to be able to achieve for a specific organization. So we have to look with a very careful way for the challenge that we have in a presently way in our hospitals to look for the waste production and to look for the waste management that we have to deal with them. Another environmental concerns, of course, in a smaller scale, that the issues that we are talking about, waste, energy, water, is, for example, some special of sources of pollution, such as indoor air, noise, or other environmental aspects that we usually could identify in a hospital environmental. For example, the older hospital buildings that have in their equipment or materials some chemical components, such as volatile organic compounds. And in overtime, as those materials became degraded, they will release those compounds to the air, to the indoor air, and affect, of course, the quality of this indoor air. It could put, if we evaluate this quality of the indoor air, it could put in risk the staff and even the patients. So it's when we have a building that are not prepared for a hospital, and if we put inside of that building materials that became to related those chemical products during the use of them and during the lifetime of them, and we close the windows and we have a system that it's poor in ventilation, and we have a system that could not collect it, that contaminated indoor air, we will transform those hospitals in a contaminated spaces. And we have to be able to have the tools to be able to look for those aspects too, not only for waste, not only for energy, not only for water, but these kind of other pollution sources are also important, even if they are not the heavy specifications that we have in other issues. Many hospitals, either to do the protection of the patient's concerns, they have really limitations about the design. They usually, most of the hospitals have in their healthcare facilities, they don't have enough space for to provide the ventilation, and they don't have the equipment function in the right way to provide that ventilation. Additionally, hospitals often use outdated and obsolete equipment that generate excessive noise or vibration, and that could cause discomfort during the lifetime of their function. And even the high movement of equipment, beds, or people, like visitors, and that usually they don't respect the restrictions that when hospital have to have in their guidelines. They usually could be sources of noise, and causing some discomfort for who's are healing or who were working those buildings. So we have to, when we look for an hospital and we look for sustainability of the hospital, we have to look for all the issues that we have to lead every day, not only for the big ones, because when we have to do that we have to analyze all the issues that really impact the environmental and that really impacts the social aspects, because the sustainability is not only the environmental, it's the three aspects: environment, social, and economic ones. So when we look for the sustainability of a hospital, we have to be able to achieve for a balance of the three of them. We could be able to access to look for the hospitals in a way of to promote the knowledge of the situation. What we can do a diagnostic. We have to know what we have to deal every day, what we have to deal in sustainability. Like I said, we have to know what we have in that building, not only for, like I said, the environmental issues, but to the social issues, not only for the workers, but to the community, to the people that use the hospital services, and to evaluate what is the impact, the economic impact to management those two big groups, environmental and social issues. When we know what we are dealing every day in our hospitals, our difficulties, our challenge, we are able to define sustainability programs. And the sustainability programs can be developed to promote more efficiency use of energy, water reuse after the treatment, of course, provides most efficiently waste management, and even to provide some modifications in the building to incorporate, for example, clean energy sources such as solar power. Furthermore, following these diagnosis phases, the hospital can implement sustainability initiatives that may eventually lead to environmental and sustainability certifications. Be adopting sources of management programs for water, for energy, for materials, for hazardous substances, for equipment, as well as we lead with pollution control, or in deal with such as a reduction of liquid effluent production, or controlling our emissions. The hospitals can become more sustainable. Aligning the hospital operations with the sustainability policies ensures a more responsible approach to the resource consumption. There are already established systems for environmental certification, and also for efficiency programs, which are able to prepare these hospitals to integrate the sustainability management across their entire value chain. This includes engaging the suppliers, and making healthcare service delivery more sustainably overall. On a broader level, in relation to the hospital operations, sustainability can also be extended to the community. In this, increasingly important to recognize that in order to achieve the hospital certification, everyone must be involved, focus on the most sustainable solutions to minimize significant environmental impacts. What we can really identify as a material aspect that we will use, not material like plastic, for example, but material it's for us that we that when we pretend to implement sustainability programs or to implement sustainability certifications, we identified what we have to lead, and those issues that we have to lead, we call them the material ones. So we have to identify, for example, the footprint of the hospital to know what we have to program for the future. For example, energy consumption associated with equipments or associated with building operations, and the types of the energy resources that we are use, and the needs that we have to implement to reduce the use of fossil fuels, for example. We know that we have to reduce the carbon emissions, and the key for that goal is really to look for what kind of source of energy that we are using our buildings. Therefore, when we develop a sustainability program, it is essential to include aspects such as assessing the hospitals to, for example, a carbon footprint evaluation, or create a decarbonization plan. This plan should consider the energy consumption, the energy resources, for example, the equipment's characteristics, the overall energy demands, for example, for heating or cooling, and we have to look for them to be able to implement more sustainability solutions within the hospital we will need in the future. The sustainability programs can also address other environmental factors such as water use for the treatment, contaminated liquid effluents, and to remove those contaminations, and could be able to reuse that water, that recycled water, for irrigation of hospital gardens. Additionally, the hospital's laundries are a major problem that we have in our environmental impact analysis. It is crucial to implement measures that improve that washing systems. For example, the disinfection process, the choice of detergents, and even the energy efficiency in the laundry equipment. In short, understanding the hospital infrastructure and the activities that we have there, it could help us to identify the key environmental impacts and to focus our efforts to be more critical and more efficiently in the areas that needs our help and needs to implement these sustainability programs. Their initiatives can reduce the consumption, can engage efficiently, can improve overall environmental performance by cutting, for example, in waste generation or in the different water uses. Implementing environmental or a broader sustainability certification such as ESG ESG is environmental, social, and governance standards that supports sustainability management by covering environmental, social, and governance aspects. Those certifications also facilitate the creation of annual sustainability reports. Sustainability certifications are also becoming increasingly high spread and relevant for the environmental policies, and we usually look for them with a very important tool that we could be use to become more efficiently and to lead with more knowledge to solve these sustainable problems. They serve as evaluated tools for efficiency management, both economically and environmental. More and more buildings managers are adopting those certifications, extending them to suppliers and to the entire value chain. There is also a growing regulations pressure for the organizations to adopt those standards and those certifications. Even the environmental policies is increasing require that the organizations reflect their environmental impacts to the sustainability reporting, helping them to identify and to control their environmental footprint. For hospitals, using this kind of tools and this kind of sustainability reports is a significant and really a challenge for the future. However, despite their sustainability environmental impacts, hospitals can, and with of course careful planning and responsibility, involve this sustainability model for the activities and for to be able to be more sustainably in the future.
1 minute.
So, okay, I'm only in the ending. So it is important to know that we have really a challenger in our hands, that we could be able to look with very that we have a serious problem, but we have a solution, and we could be able to look them with the tools that we have today, and we together could achieve a good solution for our hospitals. So thank you. I'm really able to answer for the questions that you could have to me. Thank you.
Thank you, Carmen, for your inspiring presentation. And we have a lot to talk about what you say. Well, let's move on second guest. Natalia, please, the stage is yours now. And I ask only that we use the 13 minutes as a Belgian, not a Portuguese. Thank you.
I'll do my best. Okay, so welcome everyone. Thank you very much for inviting me. It's always a pleasure to talk about sustainability, and even more with OR nurse, because you are a very big part of the change in the OR. So as Manuel said, I'm a pediatric anesthesiologist, and I work in a Belgian hospital in Brussels, Clinique Universitaire Saint-Luc. And I have created a green team, and from that we have done a lot of things in the OR. So I will go through the process why we create the green team, and then what we did and how we did. So hopefully it will be inspiring for you in the rest of Europe. Oh, I cannot move my slides. Oh, okay. So how did everything start? Well, you know, if you are sensible with sustainability, probably at home, you have raised awareness about pollution, about the carbon footprint. Well, at home, we have reduced a lot our waste. You have to know that Belgium is actually the champion in Europe for recycling. We have like 5 different bins at home for different waste. While we eat organic, we care about energy. I have solar panel at home. I buy secondhand clothes, and so on and so on and so on. And then we go to hospital for work, and we have lots of waste, and we waste energy. You know, those OR rooms that have lights day and night, climatization, ventilation, everything works all day. So there is a really huge gap between what we try to do at home and what is done in hospital. And when you see that, there was no other possibility to do something. So I started to study and to learn more about what was the OR footprint. And actually, there is 3 big scope when you try to look at what we produce of CO2. And the first one is, I mean, it's just in order. It's not it's not how important it is, but the first one is anesthesia gases. So yeah, as an anesthesiologist, I know what I'm talking about, and even more because I'm a pediatric anesthesiologist, so I use a lot of gases, and those gases are destruct the ozone layer and are very bad for the atmosphere. The second scope is the energy, and Carmen has told a lot about that. And the third scope is the supply chain and the waste production. So I'm not going to go into gas and energy because well, gas is very specific to anesthesia. Energy has been told just now with Carmen. So I'm just going to talk about supply chain and waste production, which is probably the field where we can do something at our level. So these are the 3 scopes, and I just want to tell that the contribution of the 3 different scopes is very different considering where you work, how you work. So here you have 3 different hospitals, one in Canada, one in United States, and another one in England. And you see that depending on the way you get your energy, for example, in the United States, you have energy that's very, very bad. So you have a lot here in energy, but then in Canada, they have solar panel. So energy is not that important, but probably they use more gases and not IV induction. So that part is probably higher than in England. And the supply chain depends, it's always about the same, but it can depend on the country and the way you work. So what are the facts? And it's interesting to know that around 4% of the national waste comes from hospitals. So it's a lot. And the OR produces 30% of this waste. So it's very disproportional of the place you use in the hospital and the amount of waste that you produce, 30%. And it says that one surgery, so it's average, of course, produces the waste of a family of 4 for 1 week. Each surgery produces what your family will produce in 1 week. So this is enormous. And yeah, we made that group and say we have to do something, and probably that everything is based on that kind of facts that you say it's not possible, we should do something, we cannot keep going like that. And not only in the OR, but probably some of you have seen that video. It's only 1 minute, but it's an artist, and she was a patient, and that she did that video. We can talk about it later. Okay, so as you can see, she has a breast reconstruction and she asked to keep all the waste related to her surgery. And then she made that video. But I love this video because she is asking at the end, is there another way? So she say, okay, I had that surgery, I needed that surgery, but is there another way? And the answer is yes, of course. We can give very good care, but with having less impact in the environment. So the aim of this presentation is to talk about the different type of waste, so you understand what we're talking about when we talk about hospital waste. And then I want to illustrate this with the 3R of the sustainability, so reduce, reuse, and recycle, how we have done it in EOR. And I show you that with all evidence-based medicine. So I did not invent anything. So this exists, this has been proven, and it shows that it has good results. So when we talk about healthcare waste, this is the World Health Organization definition. You have two types of waste, the general waste, and then the chemical, radioactive, and infectious waste. So 85% of the waste is general, and the general waste is assimilable to household waste, so what you have at home, actually. And this is 85% of your waste. In Belgium, it's the gray bag. I don't know in the other countries how the color is, but we represented that by gray bag. And then the chemical and radioactive, infectious, so hazardous waste is the yellow bag in Belgium, and it should only be 15% of your waste. It's not the case in our hospital, or it wasn't actually, so we worked on that. And this is, again, the definition of World Health Organization with the description of all different risky waste. So it's sharp waste, infectious waste, pathological waste, so when you have human tissues and the stuff, pharmaceutical waste, cytotoxic waste, so chemotherapies, radioactive waste. And everything that's not in that category should be in the gray bin, so in the non-risk waste. So that's the first part of the segregation we need to apply. So it's the difference between gray and yellow waste. And what's the difference of those? Well, in Belgium, that's a Belgian slide, they're both incinerated. But the difference is the way that it's carried on. So the yellow bag, people that care of those waste have a lot of protection, and the transport is more secure, and so it's a lot more expensive than the other one. And so this is the numbers of my hospital, and as you see, the difference when you treat the gray bag and when you treat the yellow bag. So it's like 5 times more expensive when you have a yellow bag. So just because it's more expensive, you should be careful of what you put in the risky waste, so the yellow bag. And then if you have a good segregation between yellow and black bag, you can start reducing and recycling your waste from that bag. So probably most of you know the 3 rules of sustainability. So reduce, reuse, and recycle. But what's it's important to understand is that there is a hierarchy between those concepts. And the first one is reduce. So it's the more concrete thing you can do is reduce the waste and reduce the things you use. Then the second one is to reuse. So don't use disposable things if you can't. And the third one only is recycling. So recycling is the last thing you can do that's good for the environment. So first one, if you look at the reduce concept, it's the way that you can reduce the waste of environmental resources and reduce the amount of disposable waste that you produce. When you talk about waste, there is 2 types of waste. There is the liquid waste and the solid waste. And just a few words about liquid waste. Liquid waste is all the drugs that you waste. And because you are OR nurses, you know what I'm talking about. If you give a drug to a patient, well, part of the drug is metabolized and used to cure the patient, but part of it is excreted from the patient, goes to the toilet, and then to the water. But part of the drug you use is not given to the patient, and it's a waste. And the problem is that, well, if you put it in the toilet or the sink, it will go to the waste water treatment plant and go to the surface water. If you put it in the bin, it will go to the landfill and it goes into the groundwater. The best way is to put it in the pharmacy, so there is a controlled destruction. So if you have propofol that you haven't used, you should never put it in the toilet or the sink. Probably put it in the household waste or give it back to the pharmacy. But otherwise, you're polluting water. And there are data. This is a study about the drug wastage. So they just looked at all the drugs that they load, and they look at the amount of drug that was wasted, so not given to the patient. And if you look at propofol, so it's for 98 cases of GA and LRA. And propofol, you have 2 liters of propofols that go to the bin for 100 cases. And this represents 50% of the propofol that has been loaded. So it's a lot. So in volume, propofol is the biggest drugs that we throw away. But then if you look at the other drugs, for example, adrenaline, you have 100% of the drug that has been wasted. So probably we load the drug in case of, because it is an emergency drug, but then we don't use it, and it's all drawn to the bin. So we have a problem with the drug we use. And there is a score that has been developed by Stockholm Country Council, which is called the PBT scores. And this is a score to see how the product or the drug is bad for the aquatic environment. So it looks at the persistence, so how it stays in the aquatic environments, bioaccumulation, and toxicity. And then you can find any kind of drug in the internet site. But if you look at propofol, it has a PBT score of 6/9. It's huge. So it's the biggest amount of drug we throw away, and it's the drug that is the less really, really bad for the aquatic environment. So be careful about that. And the solutions we propose is, well, think before you load a drug, because sometimes you have like protocols, and you know that for one kind of surgery, you have to load a lot of different ones, but then you use only 2 or 3 of them. So it's interesting to talk with your anesthesiologist or with your colleagues, or, yeah, I really need that. The rest, maybe I can wait or I can see before loading. Then for emergency drugs, there are pre-filled syringes like this. So you only open them when you need them, but then if you don't use it, you can keep it for another patient or for another emergency. Another way, if you don't have the pre-filled syringes, is that you can have syringes with the vial just next to the syringe, so you can quickly have the emergency drug. And then because I work in pediatrics, sometimes I have that problem. I only need 1 milliliter of propofol, and all the rest is thrown away. So we ask sometimes the pharmacy of producers to have smaller vials for pediatric anesthesiology, but we don't really have a solution for that. So that was for liquid waste. Now it's solid waste. It's more about reducing overage, and the overage is really the occurrence of unnecessary open material, and that happens every time in the OR. You know what I'm talking about. You open things for your surgeon or your anesthesiologist, and then you just don't use it. So it has been created, it has been packed, and then you just put everything in the bin because it has not even been used. So it's abolish dispensable items such as redundant products in packing. So you have a pack for a surgeon, and then you have 2 things that you don't use, or and the other thing is reduce the volume of packaging, so you have less waste. This is a French study. They looked for 152 surgeries, urology, gynecology, and digestive. And they looked every time there was a wastage. And they defined wastage as an open, unused device. So something that has been open in the table of the surgeon and that hasn't been used. And then they saw which were the reason of the waste. First thing they saw is that 20% of the total cost was allocated allocated to the supplies was wasted. So 20% it's enormous. And for their hospital, which is about 8,000 surgery, it was 100,000 euros per year that were going directly to the bin. And when they looked closer at the reason of the waste, the first one, so in one case over 3, it's because there is an anticipation of the surgeon's needs. So probably the nurse, and she wants to do well the work, she anticipates things that the surgeon could need, but actually he doesn't really need it. So you open thing, but it's not really needed by the surgeon. So that's the biggest part of the waste. But then you have aseptic mistakes, so something that falls on the floors, that happens. Comfort when you use a blown because it's very cold in the OR. The wrong choice of supplies, so when you open the wrong size of gloves, non-suitable supplies, it's just you open something, but then it was not what was useful. Defective or incomplete supplies, something that's broken or that doesn't work well, so that things happens. The worst is that opening a surgeon's request and then he doesn't use it. And careless mistakes, you open something that was already on the table. So these are the different reasons. And at the end of the studies, well, they said, okay, the biggest problem is the wrong anticipation of the surgeon's needs. And then they asked the person if they were ready to change, and 70% of the personnel say they would change their habits if they knew that, so if they were better informed. So just telling the people, probably we are wasting a lot, we can do something, just people are aware and can do an effort and change habits. But the first things to do then is sensibilization. So tell people, there is a lot of waste in the OR, we have to do something. And then on the study, they developed what they call the just-in-time model. So it's when your surgeon asks it, you open it, but don't try to open things before you ask. I know it's not easy, and surgeons are not easy persons, but I did that talk in front of surgeons, and they understand. If you tell them, okay, you have to change your habits also because there is a lot of waste, and it's a lot of money that's wasted also, they can understand. I'm not talking about vital emergency. I'm talking about just normal surgery. Then the other thing is the optimization of the packs. And it consists actually to make one pack for very standard surgery. For example, here is for near arthroscopy surgery. Instead of opening the 32 items they need for the surgery, which will produce 32 waste, they have one pack, everything is sterilized, and then you have one waste. And so you should develop that for very standard and surgery that you do often, and talk with your surgeon. And the other thing is optimize the content of anesthetics and surgical packs. So for example, this is in my hospital. At the end of an orchidopexy, we had all this unused material in the surgical pack. So we say, okay, if at the end of his surgery we have this, we should do something, and we should take off all those items from the pack. So this is something you can do at your level, analyze your packs and see if it's efficient or not. So this was for reducing, now it's for reuse, and this is all the debates about disposable and reusable materials. Well, why did we start to use so many disposable materials? Probably because there was a concern regarding infection risk, but the World Health Organization states that there were no difference between disposable and reusable materials for surgical site infections or wound contaminations. Nevermore, we need some more studies in this area, but there is no difference actually. And this is where I need to talk about the life cycle assessment. So for those who don't know what this is a key in sustainability. So life cycle assessment is a method to measure the impact, the environmental impact of a device. For example, you have a mask. Well, if you want to know what's the environmental impact of that mask, you need to know the life cycle assessment. And this life cycle assessment, actually, it's like more like a cycle, analyzes all the material and energy, the waste and the pollution that is produced from the very, very beginning, so from the cradle to the grave for a material. So the extraction of the material, the manufacturing of the product, the packaging, the product use, and the end of life. And then you can know exactly what's the impact of a device. And then you can compare whether the impact of a disposable or a reusable device. You have to know the life cycle assessment of each device. So it is the net environmental effect, and it's a very, very complex calculation. Engineers do that. I'm not able to do that. And even more complex because it depends on your local energy sources. For example, if you use solar panel in your manufacturing, or if you use coal, it's not the same impact. And it depends on how you use equipment, of course. If you have reusable material, but you broke it every week and you have to buy it every week, probably it will not have the same impact. And these life cycles assessment have been done for a series of material, and they look at the environmental impact and also of the cost. And even in each case, you have a benefit for reusable materials, and even in the cost, it's always benefit for reusable. So it's costless and it has lower environmental impact to use reusable material. So you have here studies for disposable that were benefit for disposable. Actually, these were Australian teams, and they were very honest in the study because they say this is because we are in Australia, because we use coal as energy. So probably producing more the sterilization process makes more pollution than producing a disposable device. Just a few words about the hat, because I've always have question about that. So there is a study about hats, because in my hospital, everybody has a reusable hat. And they showed that reusable hat was superior to a closed school cap because there is less permeability, but it has to be changed and washed every day. So go for a reusable hat. It's always very nice. Reprocessing is another way to reduce your impact. Actually, reprocessing is when you use something that should be disposable and you use it many times. That's reprocessing. It's not legal in Europe for the moment. It's just legal in the USA and Germany. But you have to know that single-use label, it's only the manufacturer that can choose if something is single-use or reusable. So probably some stuff are reusable actually, but just because the manufacturer puts a single-use label on it, you have to throw it on the bin. And probably in your hospital, you do reprocessing without knowing. I mean, we do it because we have like saturation for kids. It's something that you stick on it. Well, we use it for many kids and we don't put it in the bin between. So that's the reprocessing you can do. So to resume, avoid drug waste, avoid over-preparation, custom your packs, favor reusable materials, and try to reprocess if you can. And now the last point is the recycling. Well, for recycling, you need a correct segregation between your gray and your yellow bag first. Because majority of non-hazardous waste is misclassified. This was in my hospital. Before we start with the green team, people were putting anything in the yellow bin. So we segregate well those two bins. And then you can start to recycle paper, plastics, and other things if you can. You have to know that 40 to 60% of your waste is recyclable. And 80% of your oral waste is generated before the patient arrives for surgery. So for people who say it's bad because we can get infections in the recycle bin, well, you can, when you open everything before the patient arrives, you can separate your waste, and then you can, okay, stop the recycling if you are aware of infection. And this can reduce of 50% your annual waste of output. You can recycle a lot of things: glass, plastic, paper, metal, batteries. About plastic, well, 50% of our waste is plastic. That needs a lot of staff compliance. You have two ways of doing it. We put all together in blue bag. Well, in Belgium, blue bag is for plastic. Or you can separate it by type of plastics. There is 7 types of plastic, but I don't know if someone can do that. It's just crazy. And you don't even know which type of plastic is in each device. I've tried to do it. It's impossible. So in my hospital, we put all the plastic in the plastic bag. You can recycle paper. You know, in the sterile device, you have a paper side and a plastic side, and then you have all the paper of the little boxes. You can recycle metal. Okay, so I've just have a small time just to talk about the green team. So we created a green team about 2 years ago just to start to implement the ideas we had. And the different projects are, well, first the sorting of B1, B2, so gray bag, yellow bag. We give information to the OR, to the personnel of the OR. We put some clear panels. And then we start storing plastic, paper, and batteries, and we start a recycling way. We start to do eco-responsibility in healthcare by giving seminars, and now there is a class in university for oral medical students. In my department of anesthesia, we did a big work on gas consumptions. We work on package with anesthesiologists and surgeons. And we are now working on a PEROS project. You may know that IV drugs have a very, very higher impact than PEROS drugs, oral drugs. So we are trying to give oral drugs to the kids before they come to the OR. But this is just beginning now. So this is all the problems we are faced to when we try to do something green in the OR. Well, first, it's very, very hard to reach all the OR user. It's a big hospital, and you cannot imagine how many persons come to the OR and how it's complicated to explain to someone that we are recycling and that you have to put plastic there, paper there, etc. Because it is a big hospital, we have multiple decision-making structures. So anytime you want to change something, you have to have the authorization of many structures. Well, there is always problem of compliance and resistance to change. As you know, it's a human feeling, but what is familiar is safe. So when you change things, people feel unsafe. There is a lack of knowledge, and that's why we did a lot of seminars talking about how to recycle, why to recycle, so it looked a bit easier for the OR users. And then you have false beliefs. Well, there is not a lot to do, but probably you know those persons. I had a surgeon telling me that this was a cycle, and that's because like dinosaurs have disappeared from Earth. We are going to disappear from Earth. So what I'm doing is just unuseful, blah, blah, blah. But well, you can talk to that Peter if you want. But anyway, this is the composition of our green team. The key for a green team, it's that you need the support from the direction of your hospital. And that was the key of my green team, is that the direction of my hospital is always supporting us and helping us. So otherwise, I don't think we could have achieved what we've done so far. We are 2 anesthesiologists. We started with 3 nurses, and now there are 6 because actually they are the more active person in that team. 1 surgeon, one person from the pharmacy, one person from the sterilization, one person from the hygiene. We have a logistic department chief that comes, and the OR manager. That's also a key, because when he says something, everybody does it, so there is no discussion. We have a meeting once a month in order to keep going with our projects. And this was the example when we try to put the recycling project. We did a pilot in one room, or room, telling where we will put the different bins and how we will do it. We did big panels explaining what was going in the plastic, what was not going in the plastic bin. Same for the paper, what you could put on the paper, what you could not put on the paper. And this is an image of one of my OR with the paper bin, the plastic bin, the normal bin, and the yellow bin is very, very far away from the anesthesiologist, otherwise he puts anything in it. And that's the end of my talk. I hope it was interesting. And if you have any question, please use the Q&R
area. Thank you, Natalia. I feel that we do our best to introduce the concept of reduction of environmental impact. We have 10 questions, and I start from the beginning. Bruno from Porto, and I will do the questions and ask you if you answer it not as a great concept, but as a short answer. Bruno asked, which are the main barriers to introduce the concept of sustainability in operating room? Do it.
I don't know, Carmen, if you want to answer that.
No, I think you can share your experience because you have the experience of the field, so perhaps it's interesting to hear.
Well, as I said, administrative is not really a barrier if you have them with you, and it's the case. And go for it, because hospitals need green labels, and they're always happy if there are green teams and OR teams, because for their image, it's good also to have green things in their hospital. So probably they will support you, but they like to know what you're doing, blah, blah, blah. So you have to have them with them. So administrative is not really a problem. The problem is always money. I mean, it's always money. For example, you know, the laryngoscope blades, we still have disposable, reusable laryngoscope blades, but they're like very old and we have to change them. And so they say, okay, we're going to disposable. And we say, no way, we don't want disposable. But so this means that we have to pay for the blades, and it's very expensive to buy it on the first time you have to buy it, but then you wash them. So hospitals say, okay, we're not going to pay 500,000 euros for your blades. I say, okay, but if you look for 5 years, if you have blades that you have to put in the bin, it's the same price. It's just that they don't want to put it in once at the first time. And then the other problem, well, in my hospital, is the sterilization. Well, the person in charge of the sterilization is not really green. So she always says that no, sterilization is a lot of pollution and blah, blah, blah. So, and studies show that it's not the case. So it's always, the impact is always higher when you have disposable things than when you have reusable things. But yeah, she doesn't want to listen to that. And anyway, she has 4 walls in her sterilization and she cannot do it bigger. So she said, okay, I cannot sterilize your blades anymore because I don't have the rooms. So it's always that kind of problems we have when we want to do green things.
Okay. Next question is very curious. How we could increase the concept of sustainability without put more difficulties on perioperative nurse workflow?
Can you repeat, please?
The question is from someone from Luxembourg and ask how we could increase the concept of sustainability without put more difficult on the nurses' workflow.
So I can help with something. It is the example that Natalia showed us. It's a very important example that she show a team with different kind of persons, and that is very important. But two things that I want to say about that question, it's first, we have to have a motivation from the top, because they will help that other persons in the hospital could help, and the heavy, it's not only in the nurses, but what the Natalia said, it's we have to have the experience of the field, and in some cases the experience of the field starts with the help of the nurse. So it's not, we could not take the nurse of the process. We have to have them, but we have to involve the other ones. So I think the solution is to have the motivation and to involve other personals, other people from the hospital.
Okay.
I don't know if
Yeah, I think also, you know, green projects are always very federative, and nurses were very happy in my hospital to recycle, to do things. And sometimes they come to me and they say, oh, Natalia, you know, we should do that also. It should be. So I think it's not saying to the nurse, okay, we have more work for you, and the work is shared, because anesthesiologists always, we have to sort our waste. So everybody does it, not only the nurse. So I agree, you have to do a little bit more. Okay, you have to sort. It's not that big problem, and you do it at home anyway, so it's not something really new. But I feel that in my hospital, everyone is very happy to do it. So it's not like of a thing you don't want to do. That's my feeling. But
My comment, it's only a mind change.
yeah.
Only this. Okay, next question is, when we talk about intraoperative sustainability, in one word, reprocessable equipment or disposable equipment?
I would say reusable, not reprocessable.
I agree with you. Carmen, do you want to say something?
Yes, I think it's what Natalia showed us. We have a hierarchy, and it's our guide. You have to look to them and say and talk that think that we have to first reduce the use, and if you need to use, we have to use the reusable systems, equipments, products. So it's a solution, is to look for the guide that Natalia showed us. It's the guide for every kind of waste management in all of the Europe.
One more question about the question of reusable medical device and disposable medical device. One of the bigger quantities of waste in the operating room are gowns, all sterilized gowns. Why we don't use more reusable gowns?
I don't have the experience of usable gowns, so I cannot really answer the questions. But we are having a campaign about about gowns? You mean gloves of gowns?
No, gowns.
Gowns. Yeah.
Gowns.
I would go for the for the reusable gowns. And as I show a study where they showed that reusable gowns and drapes, sterile drapes also, it's better for the planet and it's better for the money too. So yeah, if your hospital is okay for sterilization of all this, because you need a way to sterilize all this. So in my hospital, it's done somewhere else. So this means that you have to have the transportation of all these to the center where there's sterilization, then the way back. So I don't know. You have to put LCA,
we have some experience in this. The question is the amount of gowns that you use. It's a critical process in this. If it's not too much, perhaps disposable, it's easier. If you have enough quantities and the logistic support, reusable could be a good solution.
Yeah, that makes sense.
Just to say something that is very important, the focus of sustainability is the balance of the three topics: environment, social, and economic. So when we have to choose the solution, we have to think that we have to balance. We could not choose a solution that it will increase a high increase of the economic costs. So we have always to balance, but we don't have to choose some solution that will impact the life of the people that work in the hospital. So we have always to think that we have to balance the three topics.
Okay. Someone I imagine from, I don't know, sorry, that asked if culturally we don't have a good adherence to recycling and to be sustainable, how we do it inside the hospitals?
It's not an easy answer. Yes, of course. And we have an example here. Natalia said, it's not, we do it, the recycling in the hospital with happiness because we do it in our homes. So it's like to transport what we do outside the hospital to inside the hospital.
Yeah.
And of course, if we deal with people that don't use to recycling outside the hospital, it's more difficult to mobilize them to be able to recycle. But we have a lot of tools to do that. And one of them is to show that they could have, they could win with that work. For example, if we increase the recycling goals, and we have some, and the hospital reduces the waste that the costs of the waste management, we could use the difference to improve, for example, the workers in the workers spaces that they use to rest, for example, or other examples that we could be able to give them better conditions. So they will see that they will win if they provide the recycling. So, but usually we have to show them that they will win with that, and then they will transport for their homes too.
Okay. Another question is quite similar about that. It's the concept of social responsibility. Someone asked, when the funding and the financial resources don't arrive to the hospitals, how we can manage another challenge without the enough resources?
So, I think Natalia could share their experience.
Anyway, my hospital has resources and wants to be green, so it's easy for me to say what to do. And I can understand that question. If your hospital just don't have the money, well, the first thing is reduce, and reduce doesn't have a cost. So that's the first thing. If you stop wasting and over wasting things, this is something anyone can do. Even if you don't have the funding or anything.
Behavior don't have costs.
And sorry,
Changing
exactly.
behavior
Exactly.
don't have costs.
You can change this, but then it's a bigger way to see the health. Actually, it's not just focusing on the OR. And I've done other talks about health and footprint, and probably if you, I mean, we are producing pollution and we are destroying health. So we are responsible also for health because we have to care for the planet. So it's not just saying, okay, my hospital doesn't have funds, so I'm going to produce a lot of waste because I don't want to recycle, blah, blah, blah. It's a responsibility we have also because we are producing pollution, respiratory disease, etc., etc. So probably it's a problem, it's a planetary problem, the pollution of the health system. So yeah, it's a bigger way to see the things, but you cannot answer, we don't have the money, we don't do it, because we are healthcare. So we need to do something for health, and to lower our impact, our environmental impact, is also to give care to people. So yeah, it's a wide debate, but well.
And it's just what Natalia said. We started without money, but if we reduce the waste, we could identify that we will reduce the costs of the waste management. So the money that we don't have in the beginning will appear and could be used for other examples, to waste management, to other practicals. So they will appear. It's just a matter of time.
Concept of efficiency. If we augment the efficiency of the process, we have resources to do other things. Okay, we have no more than 5 minutes, and I have a question from Bruno, also from Porto, and ask, in your opinion, Natalia, what are the strategies that you identify to maintain the team engagement in this process? Because I know the project from Bruno, and the problem is we start with a lot of energy, but after 1 year, sometimes things change a little.
Yeah. Actually, this is why I think it's important to have a support from up. And we have also the OR manager that is in OR. And, you know, we are doctors, we are nurses, we are not managers. So we are not used to put a project, drive in one direction, go another project. But my manager is used to that. So he's leading the green team we have like a manager. And so he's like always saying, okay, this project, where are we on? Okay, we need to do that, we need to do that. I'm calling that, I'm calling. So we're never stuck with things. We're always going on and on. And we have a monthly meeting with the direction where we have to talk to them what we are doing. And so I think because there is exchange, like we have ideas, we are support, we have ideas, we are support, and we have the way to achieve it. Our green team is still working after 2 years, and we're still having new ideas. And the other point is one thing at a time. So don't try to change all your OR in 1 year, because it's not going to work. So it's just one thing. So first it was black and yellow beans, and then it was recycling, and then it was blah, blah. And every time we have a project, we do it once at the time, once at the time. And I think this is why we are still motivating and doing it well.
Baby step.
Yeah. Baby
The
steps.
concept of continuous improvement is the concept to me that we have to use in this context.
Yeah.
Bruno works in operating room that works with lean management for a long time, so that they want to improve all the things, including the concept of sustainability.
Okay.
Okay, thank you for your presence. To me, it's a pleasure to be here. I have to say one or more two things. First, this result is the result for a team to think about an idea and operationalize the idea. I said about Peter from Belgium, Vivien from Belgium, Jana from Finland. If I don't think about all the people, please accept my words that it's only a question of memory. The second question is, what we want in the end of the day is that we change the things in the field. We don't want to talk intellectually about the problem. We want to change where we live. This little world that was blue, but at that time, I don't know if it's so blue. And to finalize, we are in the week of the European Perioperative Nurse Day. The one is in Saturday, but we decide to work on this moment of recognition for all the week. And this is one of the activities that we have. Thank you, Carmen. Thank you, Natalia. And thank you all the people that is in our webinar today. See you. Bye-bye.
Thank you.